I'm Kate Fulb. I'm Director of Hollywood Health and Society, co-sponsoring tonight's panel with the Writers Guild East and the Writers Guild West. Welcome. This is the last panel in our series of In the Age of COVID-19, and it seems to make sense that our final panel would be about trying to return to production. So without further ado, I will turn it over to our moderator, Michael Winship, immediate past president of the Writers Guild East. Take it away, Michael.
And thank you, Kate. Good evening to all of you also, and welcome. As Kate just said, this is our final edition, for now at least, you never know, of the series of discussions we've been having over the past few months about the coronavirus pandemic and its impact on health and societal issues of concern to all of us. We hope that you found them helpful. Note too, this is all being recorded and will be available online in the days ahead for anyone who wants to take a look. Our past sessions are available there too. There are many of you on this call, and know that you can submit questions through the Q&A icon function there on the bottom of your screen. But our tentative plan is to present the questions, your questions for our guests during the latter part of the webcast. We're really happy to have a full roster of guests tonight who bring a lot of expertise to our subject, which is the resumption of TV and film production in light of the pandemic. I'm going to introduce them alphabetically. NEAL BAER is a television writer, executive producer, and showrunner. Among his credits are Designated Survivor, Under the Dome, Law and Order SVU, and ER. He is himself a pediatrician, an author and former science reporter, and a public health expert and advocate. Colleen Bell is executive director of the California Film Commission, a former TV producer who received 3 Daytime Emmy nominations. She served as the U.S. ambassador to Hungary from 2014 to 2017, a position about which we should have an entirely different discussion one of these days, given what's been happening in Hungary. She also was on the board of the Kennedy Center and chair of Barack Obama's Advisory Committee on the Arts. Brett Miller is president of production and development for Norman Lear's Act 3 Productions, executive producer of One Day at a Time, which is now on Pop TV, executive producer of Live in Front of a Studio Audience, which I should say got 4 Emmy nominations today, so congratulations on that, Brent. Also executive producer of the documentary Norman Lear, Just Another Version of You, which had its world premiere at the opening night of the Sundance Film Festival a year or 2 back. Finally, Cynthia Pop is producer-director of The Bold and the Beautiful, for which she has received multiple Daytime Emmy nominations and an Emmy win. She's also been a director of Hollywood Heights at Nick at Night, producer maybe someday to North Entertainment, and she has also been a producer of music videos and was a director at the legendary NBC sitcom Frasier. So welcome to all of you. I'd just like to add that as the sole representative of New York and East Coast production here tonight, I've spoken to some of our experts out here, and to sum up our situation, although we're already in phase 4 of reopening, we don't anticipate episodic TV and feature production to start again here until after Labor Day at the earliest. The unions here have presented an important white paper on the resumption of production to Governor Cuomo of New York and Governor Murphy of New Jersey, and everyone is hard at work trying to hammer out the details of a plan to get our movies and TV shows back on their feet in as safe a way as possible. Normally, production brings about $60 billion into the New York City economy, so we're obviously eager to get back to work, but with health the #1 priority. There are, however, a few programs in California and other places and in Canada that are getting back into production. And so Colleen, I want to start with you. When this pandemic began and its seriousness became apparent, what was the response of the California Film Commission? How have you been working with the film and TV community to get shows and movies back into production?
All right, well, thank you. I'm happy to be here with all of you. I can tell you it was a rapid response. So I work for the Governor's Office for Business and Economic Development. And when this pandemic hit and the realities of that came to light very quickly, we had to quickly pivot in terms of our CFC operations. But the state, of course, was focused, and rightfully so, on public health and safety, and Governor Newsom implemented a stay-at-home order. So what we, at the CFC, what we did, I moved everybody to telework. We have the entire staff for telework, but we haven't missed a day of operations. So issuing permits, managing our tax credit program, logistical assistance, working with, you know, our city, our county, and our state partners. However, I will say there was a moment when all production was shuttered, and that went on for quite some time. With our tax credit program, for instance, our projects all requested force majeure. This was an extreme set of circumstances, a government sanctions, a stay-at-home order, which fell within that category. So we had to regroup with all of them. You know, production came to a complete standstill in California, and it wasn't until June 12th with the California Department of Public Health announced that production could resume. And production could resume, but of course there were very much a collaborative spirit among the labor unions, among the studios, among so many entities, among, of course, the state and our representation there, to come up with a comprehensive recommendations for how production could open and what that would look like. So that's where we are now. Since production has been allowed to resume, it's been slow. It's been slow, but I can now say it's speeding up just a bit. A lot of stops and starts, as you can imagine, as the practical application for all of these guidelines, best practices, and protocols are implemented as productions consider the cost to their overall budgets of what this looks like. But I can tell you there's the strong focus is on public health and safety, but at the same time, we want to get people back to work, get paychecks in people's pockets in the safest way possible. You know, production is a big economic driver for the state of California.
I know that because of the health concerns that you mentioned, there have been a couple of feature films that have been stopped briefly for various problems and so forth. What are the protocols for getting back up and in production safely?
Right. So as you mentioned, there are, you know, there's the broad, you know, comprehensive task force, safety task force paper that was the white paper that everybody refers to, and that's fairly detailed and granular in terms of safe procedures and protocols for resumption of production activity. So our state guidance was that the production should refer to the agreements between labor and management, and also defer to the county guidance, public health guidance. We have 58 counties here in the state of California, and the counties can be more restrictive than government, but not more lenient. So that's sort of where it is right now. And the high concentration of production activity here in LA, of course, means that people are following the guidance coming out of the LA County. And in terms of, I think when you get to Cindy Pop, because she's on set and directing, I would love for her to tell you about, you know, some of the details of what those procedures and protocols look like, because she knows better. I can go through the list of them, but she's living it daily. I know, she just came off the set.
Yes, Cindy, you're exactly the person I was going to next, because you really, Bold and the Beautiful has gone back into production. So can you tell us a little bit about how that happened and what the challenges have been and the precautions that are being taken?
Thank you for allowing me to be here tonight. Yes, we have now a month under our belt shooting. And when we first got the green light and everybody got tested, and we are following the strictest guidelines of all the guilds and unions. And we had to have a rehearsal to start, no cast, just the crew, so that we could learn how to choreograph our movements, because we can't move in the same way that we used to shoot production. There has to be moving in and out, and you know, staying 6 feet apart, obviously, and wearing all of your PPE. The control booth, for example, now has plexiglass between each person. Instead of having 5 people in the control booth, there are 3. Everybody is spaced out. We've moved other people to other areas in the studio so that everyone is not on top of each other. So there were a lot of protocols that had to be put in place first, and then we had to learn how to use them. And so our cast, then we brought in our cast, and we went very slowly for the first week because we all had to relearn how to work. And so I can give you ins and outs of how it is working with the cast as well, if that's where you want me to go next.
Sure. No, yeah, that would be great, because I'd love to know, for example, how you did read-throughs, and then what happened when you actually got actors and actresses on the set. And I think that you've gotten some attention because of some of your innovative use of
Yes.
both mannequins and significant others and things, which I think people would be curious to hear about.
Yes. When there's not an intimate scene, we keep the cast 8 feet apart because they are not wearing masks, and we just pull the cameras back to long lens it and give a more compressed shot to still give the feel of being closer than they really are. But when it gets to the intimate scenes, we use, if there's a significant other, we use them for any kind of touching or kissing. And we're fortunate that some of the significant others actually look like the actors. So the back of their head, or we'll put a wig on them. But if not, we also use mannequins, so we just put wigs on them. And so the actors have learned how to grab a mannequin and pull them close. And you're only seeing a little bit of the hair. And it was awkward at first, but the actors are really getting the hang of working with a mannequin double when they need to. But the rest of the time, we just cheat the eye line so that even though they're 8 feet away, when you're shooting them tight, they still look like they're close together. And then, of course, some lock-off shots with cameras so that we can bring people close together and then have them step out. And so it gives the audience the illusion that they're right there. Then you just shoot their singles tight.
You said yesterday when we were talking that it really worked surprisingly well.
It did. It did.
Mm-hmm.
And I just did a first kiss today, and we're thrilled every time it works.
Does it affect the pace of shooting? Are you able to keep to the same kind of schedule, or is it slower?
You know what, you have to plan your day so that if I know we're cutting anything that's not romantic. Mm-hmm. If it's a romantic, intimate moment, we keep it. If it's not, we didn't need somebody to slap somebody in the face. We just cut it. We didn't need a hug that was just a friendly hug, so we cut it. So it would take more time if we left all those things in, so we have to simplify our day for sure. Mm-hmm. And you save your time for those scenes when you need it.
What do you do about testing? What are the protocols for that?
The crew tests every Thursday, and our cast is testing twice a week on Tuesdays and Thursdays. And if you are in Zone A is the actor zone, and there's only I think four or five other people that are in Zone A, and those are the people who come very close to the actors. And that's our audio, 2 of our audio guys that go and help them with their microphones because they're wearing RFs now. And but they're teaching the actors how to do it themselves. So we keep as little contact as possible. And hair and makeup people, but we've even limited that now too. And a lot of the cast, most of the casting are all doing their own hair and makeup now.
Are you, you have a COVID compliance officer on the set? Is that what happens?
Yes, yes, we have an officer there and two other employees of that company, and so they just move around the set. They remind us to keep our distance. They make sure we're complying with the rules, and they give a speech at the beginning of the day, just reminding everybody to adhere to the highest level of the protocols. And like I said, we are so grateful to be working that we take this outside of work as well, because we have to enforce those protocols in our own personal lives, because we don't want to bring it back to the set and get closed down, in addition to bringing it to any of our loved ones or our coworkers that we love, like family. It's a serious thing, and we are taking it seriously.
Are there, excuse me, are there people in the crew and cast who have chosen not to come back quite yet, just because they're still concerned?
You know what? No. Everybody was willing to come back. There are some people who are more fearful, I'll say, than others. And so that's okay, and that's good. And because we have to work to that level. We have to work to the highest level of safety. So we want to make them feel comfortable, because we all want to be safe. So, but no, nobody has left because they felt unsafe, and nobody has not wanted to come back to work.
Brent, over there at Act 3, do you have any idea of the impact of the pandemic on production budgets? I mean, what's happening with that? What's happening with insurance? How are they being impacted?
No, I mean, I don't think I can speak to that. I can tell you that, you know, our show, One Day at a Time, halfway through the season was impacted like many shows. And we had to quickly pivot and see what could we do to ultimately keep the train on the tracks, if you will. So for us, you know, fortunately, our writers had written all of the remaining episodes of the season. So we had a particular episode that Gloria Keldrone-Kellett, one of our co-showrunners, you know, she had suggested that this episode could be great for animation, and she was absolutely right. It naturally lent itself to animation. In fact, reading it, you know, if I go back to it, I don't know how we would have done it live action, but it was the perfect episode for animation. So we went on this mission to try and find a company that ultimately could do animation in the time that we were allotted, which was roughly 8 weeks. And unfortunately, everybody in LA is as much as they wanted to help us out, they couldn't. They didn't want to take on that challenge. But there was a company in Toronto named Smiley Guy Studios who took my call on a Sunday afternoon, and I said, look, this is what we're up against. What do you think? And he fortunately had already had over 85 employees that all work remote. So for them, the train was still on the tracks anyway, and to take on another project was exciting. So they accepted the challenge of working with us for our episode 7, ultimately is what that ended up being. And it was, I have no regrets. It turned out to be one of our strongest episodes of the season, and our most daring from I would say a political perspective, which also I wanted to ask Cindy, you know, in just for a second, I'm curious, are your writers, are they actively writing with all of these regulations in mind, or are they just moving forward with story as is? Like, as you said, they're not slapping, or they're not, you know, if you don't need certain scenes, are they intentionally thinking about that while they're writing?
Now they are. They had continued writing while we were shut down, not knowing, you know, where anything was going. They just kept, you know, writing the story forward. So now that there are these guidelines in place. They're rethinking a little bit, but for the most part, they'll write it and then we'll decide when it gets time to shoot it. Are we going to do, is this a moment or not? And so we'll just cut it if it's not.
Got it.
What are you, Brent, what are you doing in terms of one day at a time? Is this something you're thinking about addressing in future storylines?
We have, as I said, we have 6 additional episodes that are standing by, eagerly awaiting the green light for production.
Mm-hmm.
But as you all probably know, we shoot in front of a live audience, and that's where things become a little challenging. We have shot a few episodes without an audience, but it's really tough when you're doing multicam. The actors feed off the audience reactions. The writers are watching what's getting the laughs, what's not, and they're rewriting on the spot. And it's going to be a big shift that we're all going to have to take until we can figure out if it's even possible to have a live audience anymore. You mentioned at the top of the program, thank you for acknowledging our show that we did the live in front of a studio audience. That too, that was the whole point of it, was to be live in front of a studio audience. I don't know how we're going to do that in the immediate future. I can tell you flat out, Norman hates a laugh track. So that's not something he's eager to play with. He famously will say he loves, for him, it's almost a spiritual experience as he watches people have the big belly laugh and they roll over out of their seats and they come back in. And so, we're all thinking of these things and how do you move forward in that way? I don't know. I don't think, unfortunately, an audience right now is priority, as we're all trying to shift back into production as fast as we can. But I think it's definitely being discussed. But unfortunately, I'm not a person of authority to speak on it because I don't know exactly where they are.
Yeah, I was actually wondering about the laugh track on the animated, about that, because
well, if you notice, we didn't use a laugh track for our animated episode.
Yeah, but on some of the others there are this year, right? Or was that all live audience?
That was all
live audience. Fantastic.
Yeah.
And what about recording for the animated episode? What about the recordings for the performers? Were they doing them from home?
Our post production supervisor, Sandy Hockman, was incredible in the research she did to find a sound engineer who could go to each actor's home and sit outside their home, and the equipment was all wrapped and very safe. And the actor went in, got the equipment, and then we walked them through on Zoom on how to put it together so they could record themselves. And we then watched them as they would record and directed them through the screen or through the Zoom session in order to give them the cues that they needed. Phil Lewis was directing that specific episode. And then for the actors that weren't in LA, we did the same thing essentially, but we just shipped it to them. Lin-Manuel Miranda was, I believe, in upstate New York. Gloria Estefan, she was down in Miami. We sent her something. Melissa Fumera was, I think she did hers in a garage. I mean, it was wherever we could find the best sound and make it as safe as possible for them to record it, they did.
Very creative. NEAL BAER, as both a doctor and a writer, showrunner, well, one thing that struck me when we spoke yesterday was that you spoke about how the science involved right at the moment is provisional and not definitive. So what exactly did you mean by that? And I think you said you had some new reports, some new data about the situation. How safe is it to get back up and running these days?
The answer is no one really knows for sure, which is problematic because we want, as you just said, I like to talk about the science for COVID-19 being provisional versus measles, pretty definitive. And so we're learning every day something new, and that's having an impact. And that's having an impact on social policy as well. What we thought a couple of months ago isn't really where we are today. So for instance, well, to step back for a second, I think about this pandemic in terms of what we knew about HIV and how that was provisional as well. But we did know how it was transmitted. It was through IV drug use, needles, blood, or sexually, and not through coughing, sneezing, or any kind of viral droplets. So we could prevent it by either abstinence, testing the blood, not shooting up, and using condoms. So that still didn't work, and lots of people still contracted HIV. And that worries me about COVID, because even though we knew how to prevent HIV transmission, still, even today in the US, 1 out of 2 African-American men in the South who has sex with men is HIV positive. And so we're not getting the medications to them. We're not doing what we need to do. 40% of African-American men and 20% of Latinx men who have sex with men in Los Angeles are HIV positive. So I think that's telling us that we're not so good at preventing, and we're not so good at following through, and we're not so good at getting people the medications they need. And we don't have therapeutics yet for COVID. So that makes me wonder, do we trust people to not go out and hang out with lots of people and then come onto the set? So there's this whole huge issue of trust. And it also has informed us that it's not just about our families, our kids, our spouses, our partners, and the people we live with, multi-generationally if we do. It's, whom we work with, and then I think Cindy was saying we could bring it back to our families or to people we live with. So that's a thought, and it's a terrible thing to say, but as a physician, I always say, don't trust anyone but yourself, because you just don't know where anyone has been. So what do we know about, that's not a very trusting thing to say, but it's the truth, as I've said just recently, and just the terrible numbers we have for HIV still, with no vaccine, by the way. So right now, 1 out of 5 18 to 34-year-olds who've had COVID are not feeling themselves, they're not feeling well 2 to 3 weeks later, versus when they've had the flu, 90% feel better after 2 weeks. So this is a very different kind of virus. It attacks many parts of the body because it attacks what are called ACE2 receptors. We have them in our kidneys, we have them in our lungs, we have them in our epithelial cells, or the cells that line our arteries. And that's why we have such a constellation of bizarre symptoms, from rashes to fogginess in the brain to cardiac problems, strokes, blood clots. It's not predictable. So first of all, young people can get sick and they can be fairly symptomatic or not at all, but the ones who do get sick, they don't get better, a good portion of them, at least 20% over a long period of time. There was a study recently of kids in a dialysis center and all of the caregivers, and this was in JAMA, and 45% of the caregivers, the healthcare providers who had PPEs, everything, seroconverted. And they were really trying not to and using universal precautions. So we're not sure still, we know it's through the droplets. We know it's probably not so much on surfaces unless someone has coughed or touched a surface and you touch it immediately and then you touch your eyes or nose. But there's still a high level of transmission amongst healthcare providers, which is really worrisome. And then with kids, kids do not get as sick. We do know that, though there is the multi-system inflammation syndrome, which is really worrisome. It's like something called Kawasaki disease. And there've been, several hundred kids who've gotten it and they get really sick, and it's an inflammatory disease and it can affect their heart. And we don't know why, but it happens. So you have to take that into account. And then infants are more vulnerable than children. And we're not sure why. We think that kids are not as vulnerable because their receptors just aren't as developed, but we don't know for sure. So then when we're talking about, I think about the sets as like going to school. It's like very collaborative, you're in close contact, there's a lot of interaction, and it's, probably you could liken sets, what are they most like? They're kind of most like being in school and doing projects and things like that. And so, when I think about schools, I think we're doing a real disservice to families by talking about kids going back to school, because pre-K, K, young elementary school kids going back to school is very different from high school kids going back to school, because high school kids, we know, can be just as infectious and transmit just the same as adults. And there have been new studies about that. So maybe high school kids shouldn't go back to school to infect people who are more at risk, like teachers, older teachers, staff, faculty. We have to think about administration. So we have to think about all those things, and maybe we should have elementary kids going to school and high school so we can spread them out and socially distance them more. So all of this provisional science, there's a lot we know. We do know that masks are really helpful. They don't prevent it fully, just like condoms didn't prevent HIV fully, but they certainly prevented a large number, in the 90s%, sometimes 80, high 80%, or into the 90%. So it just depends on how attentive each of us, each one of us is to masking and not going out and having this kind of social contract where we really say we won't do it. There's been discussion, like places like Tyler Perry has his own studio, and if you could keep everybody, the cast and crew, in a studio and quarantine them for 2 weeks and they didn't leave, it'd be perfectly safe to shoot. But we can't do that. So we can't really, quarantine, the bold and the beautiful staff and actors. Though you could, I guess, because you don't do outdoors, you don't go on location. So that's really helpful, right? So you could apparently, if you really wanted to be safe and not have to wear masks, you could just like house everybody there. I mean, but you couldn't, of course. So the challenge is, what is the risk versus, I talked to a showrunner recently who has, I think, 4 shows on, hundreds of people he's responsible for. This is a disaster for the business and for the industry and for all the cast and crew and writers, directors, actors, everyone involved. They need to go back to work. So how do we balance that? And is balance the right word when we don't know the science? Is the best thing, just as Cindy is doing and Colleen is advocating, is to take as many precautions as we can. But I think we have to be very honest with ourselves and say, we do not know really the full outcome of COVID yet. We don't know if kids are going to have what we call sequelae effects later on. There's some studies coming out of Germany and Italy that are saying possibly some kids are more, likely to have ADD or some concentration issues after having COVID. Where do we draw that line? Being just completely, we can't be 100% preventive, as I said, with, this hospital that, where the healthcare workers got sick. So what do we do? It's just the toughest question that we've probably ever faced in our working lives.
Colleen, Neil was mentioning location, and I was reading the article that ran in the LA Times last week about production, and they were saying that one of the problems that's being faced is the whole idea of neighborhoods rebelling against the customary crews coming into their areas and shooting, and that there's been some pushback and resistance from neighborhoods to location shooting.
Yeah, well, I have heard that there has been some of that, and Paul Audley, who leads the Film LA, who does all the permitting here, I have heard that there have been some conversations in that direction. It's interesting because there was a time you have Airbnb and you have an asset, if it's your home, your apartment, or something else, and you can utilize that to generate income. And so that was big business for a long time. And communities really kind of worked together collectively. You could have apartment buildings who the people who live in the apartment have come together and said, hey, we've got a beautiful courtyard. Why don't we all come together? Why don't we rent out our space for filming, and then we can split that money, or it can go into improvements for the building. There are all sorts of great opportunities out there for people to participate in filmmaking within their homes, within their neighborhoods, and that's a beautiful, great thing. I mean, that's a win-win for everyone. You get the the directors who get to have a diverse range of locations to choose, which is terrific. And then you have people who have the ability to generate some income off of their assets. So that's a really good thing. Right now, there's a lot of fear out there just in general. This is just all about, this is really just mitigating risks. Listen, the fear is legitimate. None of us have been in this situation before. This is a massively disruptive and chaotic and scary time for so many people. But at the same time, there are a lot of very well-intentioned, smart people, at the table discussing how to mitigate risk and implementing structures in order to do that. So that's sort of what I like to see is that side of things, is the thoughtful approach between government, between private enterprise, and between our departments of public health, all working together. Again, safety and health first, but getting this economy kind of getting up and going again, getting some paychecks in people's pockets. It's, so that balance, as you mentioned, it's a very, very complicated one. It's a complicated one. However, that is definitely, the focus and sort of, and where we are now.
Neil, you actually, in the third season of Designated Survivor, you actually had a pandemic storyline.
We did.
How did that come to be, and how was it researched, and what was the message you were trying to convey, if there was one?
Well, we did have it was interesting to go on Twitter, because once COVID started, the show really took off in the third season, and people wanted to know how we were so prescient that we could have a pandemic that was worse for African Americans and caused some voter suppression. And we were seeing this happen in Wisconsin in court cases. And we do see that COVID has, 3 times the number of African American and Latinos die than Caucasians, or 2 times do, and 3 times more likely to catch it. This was all new data in the New York Times, where they had to sue the CDC to get the data. So that's where we are, with the government, the feds right now. So we have to really talk to experts who are doing this research. And that's what we did. So I was interested in what we call zoonotic transmission from animals, like the bats, for coronavirus to people. And we read David Quayman's book that came out, I think, in 2012, about all these issues. He writes about it now. And he was very fearful in 2012 and said some bad, SARS and MERS had happened, and he was very fearful, and he said it's going to happen again. And so we said, as a writer's room, why don't we talk to some experts about this? And so we started talking to people, and it really freaked us out, because they all said the same thing. It's going to happen again. It's going to happen again. And we have to be prepared. And as you know, the Trump administration disbanded the office that was in charge of pandemics. So, we weren't prepared, obviously, as we look in retrospect and today, we weren't prepared. And that's part of the problem for us now in terms of working again, because we weren't prepared. So it wasn't that we were prescient. It was really just, it's all out there, and we just picked up on it, talked to people, and it just happened to really correspond to what was going on. And the reason that it's a complex reason that African Americans contract it more commonly and die from it, but it's really about who works shoulder to shoulder, who's on the front line, who's working in factories, who's working in grocery stores and places like that, versus those of us who are lucky to work at home. So that's one factor, and another is what we call social determinants of health, where if you live in an area where there's lots of multi-generational families, and you have to go on the bus to get to work, and you have to drive to get tested, and you don't have transportation. So all of these factors contribute to higher rates of infection with COVID. And then also we look at the social determinants of health. Do you have access to good health care? If you don't, then you're likely to be sicker, which is the reason that you are likelier to be sicker from COVID. And so these are, so the pandemic has really just pulled the curtain off of the nasty truth about our society, which is we don't distribute healthcare equitably, and we've let this go on for so long, and now we're seeing the results of it. So there's lots we can learn about sort of social justice and health. Hollywood Health Society has really like always been committed to that, like telling those stories. And then there's a lot we can learn about being more creative. I have a show that was supposed to shoot in April and it's been pushed to September. We will see. And is there another way to do it? And everybody's been talking. Cindy's talked about it. Brent's talked about it.
Mm-hmm.
Pauline's talked about it. Like, will it make us more creative, even though we long to go back to traditional shooting? And will it make us more creative in being kinder to each other and understanding our community and, involvement with each other, as Cindy pointed out. And the other point I wanted to make is that there was another study that was just done that even if we get a vaccine, lots of people don't trust the vaccine manufacturers. And how are we going to get the little glass vials to get it to everybody? So that's what gives me real pause about, if we have the vaccine in January, great, but how do we get it out there? And what if people won't take it? So, what is our responsibility as storytellers to tell stories about that too? So really complicated, not just about getting back to work, but, hopefully in 6 months, let's say we have a vaccine, how are we going to support the idea of people taking it?
Yeah, I saw I've seen a couple I'm sure you all have too, a couple of scary surveys that were showing something like 30 to 35% of people saying that they wouldn't take the vaccine, which does not help anybody in terms of creating the herd immunity that everybody talks about. We touched on this before, and you just touched on it too, Neil, and really it's a question for everyone. It's about how do we work this effectively into storylines, especially with people. Perhaps it's been suggested that, by the time we get things rolling again and we start talking about these things, there will be a certain amount of COVID fatigue that's built into the audiences, that they're not going to want to see those stories. What do you think?
I think for us, we are an escape, and we just want to tell relationship stories, and so we don't want to go there and talk about the pandemic or COVID. We just want to tell the relationship stories, the love stories, and give people that escape that they've always, for the history of soaps that they want to see. So we're not going to go there.
Cindy, can I ask you a question though? Because
yes,
you all have been, so I understand that. And, when we did ER, for instance, HIV there was no treatment in 1994. By 96 there was. But you guys, soaps, and including your soap, have always been in the forefront of, what comes out of relationships, but single parent families and, all of these kinds of abortion issues, all the kinds of topics that it seems to me that soap operas have really led the way. So how do you feel about that?
You know what? You're absolutely right, because it seems like once a year or every other year, we do grab a storyline to deliver. We don't want to say, we like to be there for entertainment, but through our entertainment, we can educate. And so we've told powerful stories. We've told about an HIV love story between two couples, and we had our story about Skid Row. So we tackle these social issues. I think right now, since we're in it so heavily, there is that fatigue that we're not going to go there right now. I don't know what's in it for the long run, but at this moment, I know that we don't want to go there. But you're right, we do tackle those issues as well.
Brent, what about One Day at a Time? Any thought about that? getting beyond the 6 episodes you've already got in the can?
You know, I think it's we'll have to wait and see when we get there. I mean, I agree with Cindy as well. Like there is a little bit of entertainment that we need a little escapism at times.
Sure.
We also don't veer away from conversations or topics that are important to the times we're living. But I think if there's a way to find some button of comedy that makes it relevant to talk about it, we will. But I don't know that we will. And I mean, and I don't want to speak out of turn because this is ultimately Mike and Mike Royce and Gloria Calderon-Kellett's, decision as far as, they're the ones leading the writer's room. But I can't imagine that we're going to dive deep into a COVID story for all the reasons we're all discussing. But I could see easily some sort of story. Norman said something the other day to me that was somewhat, I don't know why it caught me off guard, but maybe it's partially because he's 98. And he said, never once in my life did I think that I would have to see a day where I'd have to negotiate a hug from my children. And, to turn 98 and to celebrate his birthday, he wanted to be with his family. And it was a whole, the logistics that took place to make that possible, including, a tent in the backyard so that they could all be socially distanced apart. The entire family could eat a meal together, but not to be able to hug him or see him. I mean, that's intense stuff. And if there's a way to incorporate something like that into a storyline that exists in our family, because ultimately that's what the theme of all his shows are, family based, then I can't see why we wouldn't throw that in there.
Yeah, I could see characters refusing to wear masks, for example.
Sure.
How do you all think? I mean, from what you've been hearing from other people, what you've been reading in the trades and so forth, what's your sense of what the fall season is going to look like this year on television? Is there going to be one? I know CW basically has said they're going to move their new season to January, and they're actually going to start shooting a bunch of their shows, which they already do in any case in Vancouver next month. Do you have any sense of what prime time is going to be like for people?
I'm hearing that, there are these big PowerPoints that are going out to shows that cover, their pages and pages and pages of, how to protect and mitigate and make sure that there's protection. And I'm hearing, figures, and like Brent said, they're not official, but I'm hearing like expectations of 20% more in the budget and more time, for these shows, because if you have to test, and then, what would be really great is if we could all get the rapid COVID test. Can you imagine, Cindy, if you had that? It's like, then, and that's coming. So that is coming. So we would be able to test everybody and have the result really quickly. That would be in some ways a game changer, because you would know right away. And that way, the problem is that if someone tests negative, are we sure that they're not like still, have they been exposed? But it's less likely. I mean, there's always every kind of scenario you can think of. But in general, if we have a rapid test, like Cindy, how long does it take for you guys to get your test results back?
We usually get them back in 48 hours or less.
So if you did it like, I guess everybody would feel a lot better and everybody could just go to work, right? If you had the rapid test, it's like, boom, it's like, okay, go. So,
Right.
So that's
then I was just going to chime in there regarding the testing too. Also here in the state of California, we have a priority tier for testing, 4 tiers. And so entertainment production workers fall into the 4th tier because that's routine employer testing. So when there are moments of surges, for instance, it could mean because of the prioritization of access to testing and also and processing of those tests, entertainment production workers, it may take longer, and it has taken longer. I've actually been in quite a few different phone calls with healthcare providers and some producers who have experienced this. So this would be sort of in surge times. But I agree that it's an advancement in testing would be very helpful, because as everybody knows, time is money on a set.
Mm-hmm.
Yeah, I mean, I had an antibody test about 7 weeks ago, and I had the result back the next day. Um, but it's a quandary as to how we're going to be able to handle all this. Are there aspects of production, of traditional production, as we've always known it, that you think, even after this is over, are basically gone for good?
Was that a question for me?
Well, anybody in the
anyone?
group, yeah, anyone in the group, actually.
For anyone? Oh my goodness.
Sure.
You know, I'd like to think not. I would like to think not. I mean, right now, obviously, there are restrictions on how many people can be on the set, as you know, no live audiences, you know, no visitors, etc., and large crowd scenes. Well, because of social distancing, that makes it very, very difficult. But who doesn't love those great scenes, like, you know, La La Land on the freeway, which is, I mean, all the people dancing and all together and close. And how about all the scenes from, you know, music festivals, those types of scenes when everybody's packed together. I mean, that's just, gosh, they really enrich any production so much. So I'm optimistic and I am hopeful, because I believe in science and I believe in innovation, and I believe we're going to get there. I really do. I think we're going to get there, and we're going to figure this all out. And so slowly but surely it will resume to, but again, I would say sort of a new, more societal normal. People might be more risk adverse moving forward in a variety of different ways. This COVID has presented itself, but in controlled environments, production types of environments, do I see people getting together for, you know, large crowd scenes, etc.? I do. It's not going to happen in the near future, but someday.
Brent, do you got? Go ahead.
Oh, I love not driving to pitches. So it's like, okay. I went to Sony, and it's like, hey, you know, you're doing it from right where I'm sitting, and you can like make it pretty fun. And it's actually was like, it's made them more creative, because you're using I'm talking to my friends, we're using pictures more and things, you know, you're not there to can't take everyone's temperature in the same way, but you can put up faces and do all kinds of things that you just kind of didn't have permission to do before. So that's been, you know, really positive, that, oh, okay, there are lots of ways to do the meetings, particularly without having to drive and get in, you know, all that time wasted, so that, you know, you can really focus on doing the work. And then, you know, people who are in Zoom rooms are, you know, there's the good, which is it's very focused. You see everybody and you get the work done, but it's exhausting in a different way. So it's more efficient, I'm hearing in general from friends, but it's also exhausting. And, you know, some showrunners are demanding like 2 hours in the morning and 5 hours in the afternoon. And it's just like, wow, because you're just there. You know, when you're in the room, people get up and you take a break and you go get coffee, and it's like a more social atmosphere. And Zooming feels like, for pitches and for studio meetings and things, it's much more formal. You're not, you know, shooting the breeze. It's like you're just there to get things done. So I kind of like that, but I do miss the collaboration in person. You know, when I'm working with people on these projects I'm doing, it's all by Zoom, and it just feels a little formal. But on the other hand, it feels like I'm learning better ways of time management.
Brent, do you guys have a tentative plan in terms of bringing back one day at a time? I mean, is there a?
We don't. We have. Well, I'm told. I haven't gotten the official confirmation, so I don't think I'm speaking out of turn. But CBS has said that they would like to air our first 7 episodes that aired on Pop on their network this fall.
Oh, great!
Because as you were saying earlier, yes, there are holes in these schedules now that there, you know, has been a delay in production. So we are excited about that, because it'll be our first. I mean, we're like this little engine that went from a streamer to then a cable network to now we're going on the traditional broadcast network. So we'll see what happens, but we're very eager and excited to introduce the broadcast world to One Day at a Time. there's something, you know, it's where Norman started his career 40 years ago. So to have
Sure.
it full circle is kind of amazing.
Cindy, dumb question. What are you doing about craft services and stuff?
There are none. No. Well, no, there are none. We have on the set, we've just got a box of individual snacks that you can go by and get that are pre-wrapped. We never really had a craft service on the set because we are right next to the commissary. So the commissary was open, so we never had to provide a craft service. We had coffee and tea provided, but no real snacks. Well, right now we don't have a commissary. So you have to, everybody's bringing their lunches and coolers and you know, ice bags. And for the control booth, since they are providing lunch, you can order ahead for lunch, and we're right next to the Grove, so a lot of people will go out. However, we try to encourage people to bring their own because we don't want them to go out to the Grove and then potentially bring, you know, interact with everybody over there, then bring something back. So I'd say probably 85% of the people all bring their own lunches. And there's snacks in the back, like I said, some pre-wrapped snacks that and energy bars that people can grab if they need to. And we do provide coffee in the morning, you know, touchless coffee containers and everything that people can use. But, and there's no eating on stage either. Mm-hmm. You have to go out. We have a balcony off the set, so you can go outside and eat your lunch. There's designated tables to space apart, but there's no eating or drinking on set because you don't want to remove your mask.
Mm. Well, listen, I want to go to some of the questions we've got from people who are watching this and get to some of them. One is from Jill Hargrave, who asks, are production companies still looking for new screenplays, scripts to option, or is there a backlog because of COVID?
Well, they're definitely taking pitches for TV shows, but they are going to, you know, they've had rooms and they have scripts from last, as Brent said, from last March that they have to shoot, and they're scripts from shows that are successful. So those are going to get, I imagine, at the head of the line. So it's not impossible to get a new show going for the writing of it, but you're going to be behind others most likely.
I have a question, similar questions that came from a couple of people, which is that whether or not production companies and studios could make vaccination mandatory, so that if they didn't want to have the vaccination, you could legally say, I can't hire you.
Well, it's mandatory for school.
Mm-hmm.
So, and it depends on the state. So there's various states have different regulations and laws about how to opt out for it. So that's a good question. I don't know the answer to that. If a production company could mandate a vaccination certificate in order to, because, you know, you have to show that you know, when you're working in certain other fields, you have to show that you don't have TB. So, you know, if you're going to work in the healthcare field, so you have to have certain tests. Colleen, do you know the answer to that at all?
I was just going to say, I'm sure that there'll be quite a few conversations between, you know, labor and management moving forward regarding vaccines or advancement in therapies, and that's kind of where I would leave it. So that would be my guess.
I have a question from Dan Caton, who's actually watching this from the UK. So he's up kind of late. said, thank you for hosting this panel. I'm writing from the UK where we're slowly and carefully moving back into production, although this could change any day due to the potential European spike. I want to ask Colleen and Neil if they could envision the time when production in Los Angeles will truly begin again. I understand this is almost impossible to answer, but I was just wondering if there's any kind of ballpark date.
Oh, yeah. Well, thanks for tuning in all the way from the UK. Appreciate that very much. I can't read the tea leaves, and I don't have a crystal ball, so I don't know exactly. We're just sort of watching progressive movements. As I mentioned earlier, productions are really trying to. There's training going on for COVID compliance officers. There's implementation of all the safety procedures. There's factoring in the budget. Procuring PPE. There are all of those things. There's still some negotiations going on between labor and management. There's a lot happening, but there's a lot. There is some progress. So I am noticing that quite a few projects are delaying. So even projects that have requested force majeure, for instance, from our film and tax credit program here in California, and also I speak to my counterparts in other jurisdictions, and people are requesting an extension of the force majeure. So that means that they need more time. They need more time to get things up and running again. So there are some delays. You've got those kind of delays. You've got some travel restrictions. You've got people waiting for an advancement in therapies and a vaccine, but at the same time, the more practical application, like you've got happening at the Bold and the Beautiful, they're not. I wouldn't say they're learning. It's so controlled. It's not necessarily learning as you go, but recognizing like how best to do it, how to do it faster, but as safely, how to do it less expensively moving forward. I mean, all of that kind of coming together. But again, yeah, I anticipate. I'm sitting here in my office, friend from the UK. I'm looking at the Hollywood sign. It's a beautiful sunny day. I'm an optimist. I really think that it's going to be rolling again.
If it's a problem, for the most part, a huge majority do, and they wear masks, then I think we have possibilities of doing things. So it really is up to everybody.
It is.
This is an important question, I think, from Lisa Garibay. She's asking what protections are in place for those without any authority to stand up for themselves or others on set when prevention protocols aren't being followed. I've heard many PAs and the like express fear about their workplaces because supervisors are not being safe. I'm hearing about this mostly from those in the reality sector, that these workers are being taken advantage of more than ever, and it's a potential life or death thing if they want to stay employed and in the industry and pay rent and eat. Certainly, this is something that we've heard too from people who are deemed essential workers who may not be able to protect themselves.
Well, I'll just answer. For us, we have the COVID compliance officer on set, and that's why we have this company, because we want people to go to them. If they don't want to come to us, they can go to them directly and say, I don't feel safe here, or I'm having trouble with this. And then that compliance officer is a go-between between them and the company. I feel like we have enough of an open door policy on the set that somebody could come to us, but it's nice to have that third party, because we can, as a company, we can go to them and then they can go address it with somebody else, just so you're not going, nose to nose with somebody going, you need to do this or you need to do that. That there is a third party that can do that. But for the most part on our set, we all have our checks and balances, and most people say, thank you for the check. But if somebody is having a problem, they go to our compliance officer.
And what's the background? What's the training of the compliance officers? Are they?
these, the compliance officers that we have, they're either retired firemen, paramedics, or not retired paramedics. So they're in the medical field, and so they are trained in health and safety. And then, of course, with this pandemic, they are enforcing the protocols that have been put forward from all the unions and guilds. And they also are on top of whatever new medical information is out there on a day-to-day basis.
Mm-hmm. This is a question from Joe Schroeder. I know you, Joe. What do you all believe the return means for nonfiction production? I imagine game shows are safer and easier to produce given the guidelines, but what are all your thoughts about reality shows and documentaries? I know, for example, Big Brother is going back on the air next week, and I believe they're basically confining themselves in a Las Vegas hotel. But you all have any thoughts on that?
Well, I've heard that I think both Jeopardy and Wheel of Fortune are going back into production this coming week on the Sony lot, but there have been changes in how the contestants are actually, positioned or spaced between each other, and I don't believe there's an audience. I know that from a documentary perspective, we were in post-production on a film that we're doing right now on Rita Moreno. But that we've been able to continue again remotely with a handful of people that are working remotely to kind of finish that. I have two friends who are shooting actively right now a documentary, and they have small teams, kind of run and gun teams. It's all very much just small crews following the guidelines that need to be followed, and they don't usually hire separate crews because they like to have a consistent look with their films, but they have hired individual crews that are in various cities and following various journalists is the piece that they're doing. So I know they're actively working, and then there are people who are using, getting very creative with the way they're shooting. I don't know if any of you saw what Jason Reitman did with The Princess Bride, and that was recently on Quibi. But he sent a script to all these actors at their home, and they all shot with their cell phone, and then he put it all together in various clips, and it worked out to be a very entertaining piece of content, or many pieces of content. But I'm like Colleen, I'm the eternal optimist here, and I feel like this is a time that I hope that none of us will ever forget. I don't think we will, but learn from it, and we've all taken a huge pause, and for whatever that means within our careers or in our personal lives, I don't know, but I'm hopeful and I'm excited to get back to this new normal, and I'm ready. ready.
I'll bet. Just one final one I wanted from our audience that I wanted to throw out there. I mean, I mentioned that a lot of the CW shows like The Flash and Riverdale and so forth, they shoot in Vancouver anyway, and they're planning on resuming shooting next month. And I know Snowpiercer is picking up production in Vancouver. Have you all heard of are there any productions that you've heard about that have been contemplating pulling up roots here and setting up in another country to shoot? I mean, first of all, who's going to let us in? But second, have you all heard of anything about like that?
I can speak first to productions actually who want to uproot and come to California. So because anyhow, that's California Film Commission, and we administer the film and tax credit program here, and we through our schedule of applications, I can say that there have been some projects who are looking to relocate to California, and we actually are just going through this our just an enormous amount of submissions at the moment for our indie and non-indie allocation, and so that's great. People want to stay here in California. I think some are talking about wanting to relocate, travel restrictions in place, and people wanting to be closer to their families, particularly talent who have expressed that. So that's going to be interesting to see how that plays out. You know, every day I'm trying to look to how can we be more competitive in California as a state, and this is an interesting time. This is a bit of a disruptor, particularly because of these travel restrictions, which I frankly did not anticipate that they would be like this restrictive and this deep. So that's going to be an interesting space to watch.
Well, listen, I want to thank all four of you for a really interesting and stimulating conversation, and I'm really happy that this was the climax of these seminars, webinars that we've been doing, and I so appreciate your participation. I also want to thank everybody from Hollywood Health and Society for making this possible, and our colleagues at the Writers Guilds East and West. This entire series has just been an honor to do, and so many people at Hollywood Health and the Norman Lear Center at USC's Annenberg School have made it possible. Marty Kaplan and Kate Fold and Lekha Gopal and Melissa Gattuso, I just want to thank all of them for just, you know, making me look less stupid than I normally am. And I mentioned at the top that you'll be able to watch this in a day or two. The link will be available. So if you have friends and colleagues who'd like to watch, they'll be able to see this, as will be the other webinars. And I think on the chat function that Melissa put up the links for some of the other ones. But listen, it's been great. I'm just throwing it back over to Kate Fold now to take us out.
Hi, everybody. Thank you all. Thank you, Michael. Thank you to our panel. This was a nice balance of foreboding and positive discussion. So I appreciate all of that. I'm gonna try to stay on the positive side too. And again, yes, we are recording this as we have done with all of our panels. So you can find all of the panels we've done on our website at hollywoodhealthandsociety.org. There's a special page devoted to all 16 of them. And they'll also be on the Writers Guild websites as well, both East and West. So people can take a look. Thank you again. Before you sign off, or when you sign off, a survey will pop up and ask you what you thought of tonight's discussion. We'd love your feedback. You'll also get pinged by an email later if you can't fill it out tonight. But we'd love your feedback on this and all of our discussions. Thank you again to all of our panelists, to Michael, to Bo Williman, who's not here today, but who helped moderate half of them as well. I hope you all stay safe and healthy and serene. Thank you all.